Okay, I'm going to go ahead and say we should get started here. Welcome. This is Carla Blackmar. I'm the project manager for the Public Health Alliance of Southern California, and this is our 6th call in the Department of Environmental Health or Environmental Health Alliance call series that we've been doing. We're so pleased to have you all on the call today. I wanted to remind you about a few housekeeping items. In case you didn't hear it earlier, we currently have all of our callers on mute. If you wish to, we will unmute our callers during the Q&A unless we have problems with feedback, in which case we will keep you on mute. But if at any time you wish to ask a question, you can go ahead and unmute yourself by dialing *6, and you can mute yourself again by dialing *6 again. If you are also using the mute button on your phone, you're going to need to both unmute your phone, and you're also going to need to unmute yourself using *6 until we unmute all lines. So I hope this won't prevent us from having a good conversation today, so please feel free to use the *6 if you wish to speak. Secondly, please make sure that you're logged in either with your phone or with your computer for the sound. It's fine to be on the Start Meeting screen sharing, but if you can just make sure that you're either using the audio on your computer or on your phone, that would be great. And then finally, we do have the presentation for anyone who has had a hard time downloading startmeeting.com available on our website, which is phasocal.org. And you will see it when you go to that website. There's a toolbar at the very top, and on the far right-hand side, there's a tab that says EH Call 6. By clicking on the presentation here, you'll be able to download it and follow along with the presentation or on your computer. So again, it's phasocal.org. All right. I think, and one final thing, if you are hoping to apply for REHS CEUs for this call, please keep track of the phone number or email address that you use to participate in this call, because you'll be asked to submit it in the survey that we will send out after the call, which you need to complete in order to get your CEUs for this call. So go ahead and keep track of that. And without further ado, I'm going to turn it over to Gail, who is our Food Systems Chair here at the Public Health Alliance of Southern California, and also the Nutrition Manager with Riverside County Department of Public Health. Thanks, Gail.
Welcome. I want to say this is really awesome. We've had just great response and webinars over the last 5 months. And for August, we have a fabulous topic, and it looks like we have 64 in attendance, which is just really, really exciting. So with this, I want to introduce our webinar topic today. It's how collaborative efforts between the Department of Environmental Health and the Health and Human Services Agency in the County of San Diego are advancing a healthier food system. And with this, we have 2 expert presenters today, and I'm going to introduce both of them at the same time, and then they can just go ahead and do their presentations. First, we have Liz Pozzebon. Elizabeth is the director for the County of San Diego Department of Environmental Health. She is passionate about developing state and local policy in food safety and has been recognized for her efforts and expertise. She has a Master's of Science in Environmental and Occupational Health and over 22 years of diverse environmental public health experience in the areas of food safety, foodborne illness, surveillance and response, hazardous materials, hazardous waste management, public housing, recreational health vector control, industrial hygiene, underground storage tank installation, and removal and site remediation. She is also currently working on her doctorate of public health. Her efforts in improving food safety were recognized at the national level in 2005 when the food safety program she led was awarded the Samuel J. Crombine Consumer Protection Award for developing and implementing an effective food safety program. Her professional accomplishments have also been recognized at the state level by the California Environmental Health Association during the year 2000 as a Registered Environmental Health Specialist of the Year, and in year 2009 as a California Conference for Directors of Environmental Health Manager of the Year. So welcome, Liz. And also presenting with us is Naomi Billups. Naomi is a Public Health Nutrition Manager for the County of San Diego. Naomi has been instrumental in food systems in San Diego through assisting to establish the San Diego Food System Alliance, designing the Food Systems Community Putting Prevention Back to Work and Community Transformation Grant, interventions, and is a program lead for the Sodium Reduction Grant. So welcome, Naomi and Liz.
Well, thank you very much. Good afternoon, everyone. I'm Liz Pozzebon, Director of the Department of Environmental Health in San Diego County, and Naomi Billups and I, our Public Health Nutrition Director, will talk about some of the food systems change efforts we've collaborated on over the last 3 years and its relevance to environmental and public health. So next slide. The future of environmental public health is already here, so it's important more than ever that we widen our lens so we see the changing landscape and so we can be at the table to actively participate in food systems change efforts. I'm concerned that if we aren't there, we may jeopardize the significant strides we've made in food safety over the last several decades. Historically, the focus of environmental public health was on prevention of infectious disease, fraud, and environmental contamination. And for the most part, we've been successful, and these are still areas that we need to remain vigilant in, among many others. And I can spend a day talking about them. But today, Naomi and I will talk to you about some of the things we worked on together to improve our local food system in San Diego County. And we hope you leave with some ideas and with the realization that our field is being influenced by changing cultural norms associated with chronic disease prevention and environmental sustainability efforts. These are real environmental public health issues that we need to do something about today in order to help future generations. So it's important to note that the decisions we make about these things today will impact future generations. And next slide. Our food system is multifaceted and should ensure healthy food production and delivery for all. Our challenges today include the centralization of our food supply and a heavy reliance on food imports, which increase the scope and the impact of foodborne illness. Obesity is, in many ways, a foodborne illness, and the public wants to reverse this trend by eating healthier and going back to more sustainable food systems practices like composting and growing our own fruits and vegetables or purchasing them from the local farmer. And we must consider and evolve with these change efforts so we can make sure food safety is an integral focus and not perceived as a barrier to healthy food systems changes. This means we may need to go to the balcony in order to consider our food systems laws and policy from a much broader perspective. Next slide. From our experience here in San Diego, transformational food systems change is influenced by interconnected relationships between food and society, health, and the environment. This makes collaboration with others on these change efforts more important now than ever. It should even prompt us to look more closely within our own environmental public health professions. With so many diverse programs within environmental health, you can see that when considering food systems policy, we must also consider solid waste disposal, water quality, and land use in addition to food safety. Collaborative partners will include public health, agricultural representatives and regulators, schools and other institutions, food industry representatives, NGOs, and academia. You can also see from this model on the slide that when one of these factors change, it could impact the other dimension within the model. A good example that I can think of is the no bare hand contact revision and the reversal in the legislature. With the no bare hand contact rule change, it impacted cultural norms of some segments of the food industry, and there was also a concern expressed about gloves piling up in local landfills. So the effort failed. And this is because some cultural norms and environmental sustainability were not factored into the design of the regulatory code change because we didn't reach out far enough to our stakeholders before making such a significant change. So this model that you see on the slide may indicate that when a change impacts more than one of its dimensions, collaboration on the food systems change should be highly encouraged if it is to be successful. The next slide. Today, we'd also like to share with you San Diego County's implementation of our culinary garden agreements in partnership with our regulated facilities, including schools, hospitals, detention facilities, and restaurants. The food safety regulatory issue that this addresses is approved source. So reviewing guidance drafted from California Department of Public Health and working in partnership with our Public Health Department, our Agriculture Department, a local NGO, and our Food Safety, Land Use, and Solid Waste LEA, we developed a best practices culinary garden agreement. And a note, just for the record, that in San Diego County, public health and environmental health are in separate county groups organizationally. So in the beginning, as we think back to when food systems changes were first being considered here in San Diego, there was confusion on what exactly an approved source is. And the confusion was not only by the institutional and restaurant operators, but we were even confused within our own department. So the agreement helped us all to work together to develop a common language and a common understanding of what approved source means and why it's important. Prior to that, there really was no logistical way that we had to approve doing this. The schools were not including the produce kids grew on campus in the cafeteria meals because different agencies were telling them different things, so they just simply didn't do it. Then along came Naomi, who really tried to initiate food systems change in schools, starting with the kids themselves. So environmental health and public health in San Diego worked together to make a positive change, and it was for the kids. Next slide. The culinary agreement covers 7 general categories: water quality, septic systems, presence of animals, pesticides, composting, sanitary practices, and worker sanitation. The agreement was created in an effort to educate our operators on ways to safely grow produce at their facilities and have them agree to meet certain requirements so the gardens are operated in a manner that safeguards food, because that's what it's about. And the lesson, I think in thinking back at the lesson learned in using this agreement, it really goes beyond any sort of regulatory checklist that was built. The value of using this agreement was about learning and establishing relationships in the community that we didn't have before. And it was also about developing a mutual appreciation and understanding of what each other's goals are and working together to make a positive change within the community, and we did it. And whether or not state law changes with AB 1990 that could minimize use of these agreements, we have established lasting partnerships and learning that will continue to endure. Next slide. So as I reflect on that diagram of food systems relationships and why our use of the culinary agreement was a success in the end, it's because it touched all of these relationships displayed on the diagram. Although in the beginning, we didn't have good internal coordination. We can definitely say that, but there was a vision. Then came the collaboration of working together. Then came making it a priority for us. And then finally, the food systems changes came. The point is, there had to be leadership commitment or the positive strides we made definitely wouldn't have succeeded. The next slide. Some of our other projects, our work with the detention facilities was particularly rewarding. Naomi, our farm and home advisor with the UC Cooperative Extension at Riverside, our agriculture department and environmental health worked together through a grant to build a greenhouse and develop a garden at a local girls' detention facility. The wards, which are the girls, found it very rewarding, with one of them even asking to extend their stay over the weekend so they could participate in completing the building of the greenhouse and the garden. And in thinking of food and society, food systems change efforts can also change lives for the better. We also worked with our building department, public works, parks, and others to develop a health and all policies plan. And that plan is currently being implemented as part of a county thriving initiative. Getting the building department and public works department to realize their role in health was definitely a significant organizational culture change for sure. Now they're actively changing zoning and policies to support built environment initiatives, and we now have an agritourism initiative and our first fisherman's market that we've had in a really long time, and next is urban agriculture and edible landscapes that will be promoted. And some other things that we're working on include working collaboratively with our public health department and the building department on prepackaged corner store conversions so they can sell fresh produce and healthy foods that require refrigeration. And we started this effort with a basic plan review type guideline. But since we've been using it and with input of the food store representatives who've been involved in these projects, we're now working to integrate operational procedures into that guideline. And that's really, really encouraging that there are neighborhoods that will have greater access to healthy food and that it's also safe, and that local market owners are really interested and then they want to do more. And now I'd like to turn it over to Naomi.
Good afternoon, everybody. I wanted to point out that visual that you have on the right hand of your slide. Most of us in the local public health departments actually now have the NEOP grant, which is the Nutrition Education and Obesity Prevention project. It used to be called SNAP-Ed. A lot of us have a retail component that encourages healthier stocking and healthier options available in our neighborhood markets. This tool that Liz's team actually created was a result of one of our conversions that we did about 3 years ago in partnership with our SNAP-Ed and our CPVW efforts, which was the communities putting prevention to work. Through that conversion, we found that a lot of the store owners were confused. They were confused on what was required of the local health, environmental health department. And so with that said, we came to Liz's team and said, can you help us? So they developed this retail market checklist, basically, that was very easy to implement, and it is available for your departments as well to use. We would encourage your retail campaign market manager to utilize this if they so see fit. We're also very happy to talk to you directly about how to use this tool. And then finally, that fourth bullet, we have a lot of farm-to-institution efforts here. The International Rescue Committee is actually one of our contractors through our Community Transformation Grant. They are working with 6 school districts here, and we were able to persuade the Department of Environmental Health to give us a couple of their wonderful inspectors, and they went actually to the school districts themselves, and they're going to be doing a physical assessment of all their kitchen capacity to really give them a checklist of what they can implement to increase the scratch cooking in their kitchens. So next slide, please. So, as Liz mentioned, initially we didn't have all that great of coordination between public health and environmental health. Of course, at a very high level, I think that our departments did work together fairly well if it was a reacting foodborne illness or things like that, but not at the level of a progressive relationship and coordination. And what you're seeing in the picture here is our Board of Supervisor, Ron Roberts, and he, yes, is holding a goat in a community garden in our central San Diego area. I think what's important to realize at the end of all this is that we all wanted thriving agriculture in our community and community food production. During this period of time that you see the supervisor holding the goat, we, through the Public Health Department, were actively funding the City of San Diego's planning staff to draft a urban ag ordinance. We thought we were changing the world, getting better food to our residents, and by doing this. And what we didn't realize is that during this process is that we didn't have Department of Environmental Health with us at the table. So the City of San Diego actually released a draft of that urban ag ordinance, and there was some very valid concerns about food safety, particularly around the goats being involved in the community garden. So it caused an enlightened moment on the behalf of public health, and I think on behalf of environmental health, that we really needed to work more closely together. They were actually, Liz's staff was able to give a very good comprehensive list of what needed to be addressed in that urban ag ordinance, and the city took that into consideration, and now we have a very good comprehensive urban ag ordinance in the City of San Diego that is safe. But, you know, at the end of the day, I think, you know, environmental health and public health under real progressive leadership has fostered a working relationship through providing guidance and not saying no, right? So interpreting things and seeing the end goal and really working together to figure out how can we achieve that together for the health of our residents. Next slide, please. Picture one, great. So I wanted to talk a little bit about our work in the correctional settings. I think this is really applicable to all the counties in the Alliance as well as the whole state, actually. We had started here in San Diego County looking at very small-scale horticultural therapy programs for our juvenile detention facilities. As you can see from the picture, it's not a very therapeutic environment. It's very much a blighted, desolate, and very much a stereotypical prison atmosphere. You know, these are minor girls that are in this particular facility, and they're very disconnected in multiple different ways from nature, from humans, and so providing them an opportunity to be reconnected with food is a really great way that we felt as public health to emphasize food in the rehabilitation process. Next picture, please. So through a grant, this was actually through the CTG funding, the Community Transformation Grant, we were able to work with our Farm Home Advisor, which is in our Land Use and Environmental group here in the County of San Diego, and go through a whole building process. You can't really tell the variety of actually what we did with that, but well, I do want to point out that lead probation officer Tyra Miles, who is our champion here in probation, that can attest to a dramatic improvement in the girls' behaviors that are participating in this, the reconnection back to food, which is really what we want to see here. And also through the culinary garden agreement, they're now able to process this food, pick it, and actually work with the food services staff in their facility and share what they've grown with the other girls, really spreading that interest in food and health to these girls. Next picture, please. And so that's just another photo. You can see the greenhouse on the left, sort of. Lots of shade, but this has also been incorporated into their schooling through an ROP program. So we have a full-time instructor now and would be glad to talk to you about the sustainability of these types of projects with you individually as well. But I think the most important thing is that they are now able to utilize this and eat it and share it with their peers. The Girls Rehab Center is under the same regulations as CDE, which is the California Department of Education Nutrition Services. So that was the confusing part about regulations and what was allowed in the school meal program. So the same applies for public schools as it does apply for the Girls Rehab Facility. Next slide, please. Oh, I think we skipped one. Uh-oh. I think we're missing a slide.
I can turn it over to you if you have it on your computer.
Okay. Well, I could also just talk my way through it.
Yeah,
so that's not a problem. We actually wanted to share quite a few other projects that we have been developing with actually the leadership of the Environmental Health Department and Public Health Department. We currently have an MOU between our Health and Human Services Agency and the Land Use and Environmental Group. Really, it was spearheaded by our early interactions, specifically with the environmental health and public health. We now have in the MOU the agreement that we will be working to create a Live Well San Diego Food Systems Interdepartmental Task Force. We chose not to acronym that because that was way too long. But what's really interesting about this task force is that we have staff from all the different departments that touch food in many different ways, interacting together on a regular basis and actually coming up with solutions that we would have never even thought that we could work on together. One speaker that came to talk to us actually expressed some frustration about being able to have agriculture in the county of San Diego. And I know this isn't just specific to our county, but he wanted to start an aquaponics farm, and so he was directed to the county. And it wasn't Department of Environmental Health. It was a different department. But he came and asked, what he needed to do, and slowly the county staff opened up the regulation book and described that he could have 12 small animals on his property. So that wouldn't really allude itself to a very productive aquaponic system. So these are the types of things that we want to work through as a group together collaboratively to make sure that our residents here that want to engage in agricultural production have a smooth experience with the county. We're also engaging on a very comprehensive ag promotion plan that is being headed up, actually led by the Department of Planning Services here. We actually all are participating in input and really looking at how to implement that plan together. One of the other projects that I wanted to mention is agriculture on county-owned land. We have a very small orchard here in a park facility that we've been able to foster as a group together. Environmental Health went out to go visit and make sure that how it was set up was the fruit was being grown in an environmentally safe way. Public Health came out and helped to create a system of delivery and harvesting to actually get that produce to populations that really actually needed that produce for food security purposes. This is a pilot project, and we want to expand it. We want to see that the county property that we have is actively producing food for our residents, but in a very safe manner. So we'll be expanding that program, hopefully. The other piece I did want to come back and loop back to was the urban ag ordinance. We are embarking on a pretty extensive planning food systems project here. We're working with 6 cities, and we'll be expanding that to an additional 12. 12? That makes sense. Yeah, yep, 12. So we'll be getting all of our cities to work on food systems planning. And instead of from last time, Department of Environmental Health actually will be at the table with us, with the city planners, with public health to draft these planning documents that would make sense for everybody. And now we can go to the next slide. Great. And I'm going to turn it back over to Liz.
So here's our contact information if you'd like to reach us later. Now we'd like to open it up for questions and for some discussion by Justin Milan, who I believe is also on the phone from CCDEH, California Conference for Directors of Environmental Health, regarding the progress of AB 1990 through the legislature.
And Justin, if you're on the call, just remember you need to dial *6 to unmute yourself. I'll see if I can unmute you on my end. One second, everyone. So I'm actually think I may go ahead and unmute let's see. I'm going to try to unmute you. Justin, can you talk? All right, sorry about that. So I think I'm going to try going ahead and unmuting everyone. So please try to use your personal mute if you are not talking. All right, so it sounds like it didn't work out so well to unmute everybody. Justin, we're going to make one more attempt to hear from you. Can you unmute yourself at all? All right. We hearing from anyone else? So Liz, I think we're not able to hear from Justin right now. So I think that the main, and perhaps you can help me out with this, this is Carla Blackmar speaking from the Public Health Alliance, but the main thing that we wanted to convey is that in a previous call in March, Justin Mellon presented on AB 1990, which is a bill that's currently in the legislature that would work on simplifying the improved source process for small and informal growers, similar to school gardens and community gardens, as we've been talking about on the call today. And Justin, if you do find that you're able to unmute yourself, just go ahead and jump in anytime. But we just wanted to provide a quick update, which is that the bill continues to make its way. Oh, are you able to speak?
Yeah, sorry, I don't know why
Thank
it was
you.
difficult to come through. I've been listening to you with interest. I think you're doing a great job.
Okay, well, I think I should turn it over to you.
Hi, folks, and thanks to the presenters. That was awesome. I'm not going to repeat what you said, but I did a presentation a couple of months back, and I think the leadership in San Diego is just exemplary. The reason CCDH pursued statewide legislation, both for what we are calling community production or urban gardens, as well as last year's bill, AB 224, dealing with the veggie boxes, the CSAs, is that in many respects, except for the very, very few counties like San Diego, Sonoma, and a few others, Berkeley, that either had or were putting together specific programs to enable this production to be, quote-unquote, deemed approved under CalCode, the retail food law, is that it's sometimes easier to get a statewide, particularly in food safety, where all our regulations are really embodied and housed in one code section, what we affectionately call CalCode. Pretty much everything related to retail food safety is embodied in that one piece of law. So rather than have 62 local jurisdictions adopt different programs, we decided to move ahead and try and codify that in CalCode, where provided these small-time growers follow the best management practices, much along the lines that the best management practices that are established in San Diego or Sonoma or any of the other Napa, one of the jurisdictions there, provided they follow those best management practices, the bill says that for the CSAs, the veggie boxes, they would be deemed approved, and environmental health or public health has written into the law the explicit legal authority to step in and conduct a recall or an examination if there's any reason to believe that the production isn't safe. We're doing the same thing with 1990 this year, which applies to food, and I'll get to the definition of food or the produce, but food that's been grown in the small areas that are not zoned agriculture. We do, rightly or wrongly, just deem food produced in an agricultural setting, in an agricultural zoned land under the guidance of CDFA and Department of Pesticide Registration. We just have traditionally deemed that as approved, but we're in the sort of gray area where it's in backyards. So 1990 tries to preserve a few things. It tries to preserve local land use and zoning control, so we don't preempt local governments from zoning this in or out from a land use perspective. We retain the prerogative of local environmental or public health agencies to enact more stringent or different standards if they wish to, but they'd obviously have to go through their formal local rulemaking process. And we will potentially augment the best management practices that are on AB 224 from last year. The issue that we struggled with is really, really interesting, because everything else has been going swimmingly on 1990 this year. We ran up against opposition from the egg producers, who have insisted that we remove from the bill the allowance to have very, very small quantities of eggs. That's 15 dozen per month. That's 6 eggs a day from being produced and sold in these backyard production sites, and largely driven by public safety concern. But I think we understand that there's a lot of concern over competition with your commercial producers. And interestingly enough, representing local environmental health, and we have a long-standing tradition and obligation to protect public health, but we, along with allies like yourself, agreed to move this whole local food movement forward. we were in the rather unique situation where somebody from industry was telling us that we weren't being tough enough on public health. So the very last provision that we're struggling with a little bit in AB 1990 is whether to remove raw shell eggs completely or not. And the reason, just so that you would know, the reason raw shell eggs are in the bill right now is that in current law, in Cow Code, one of the longest standing provisions that relates to sort of local production is that if you produce produce as it's defined, which is fruit and veg and raw shell eggs on your own property and you sell it off your own property, you're largely exempt from many of these food safety requirements anyway. And also, shell eggs are exempt from refrigeration requirements and sorting or grading requirements if they're sold through certified farmers markets. So what environmental health has been doing is using the conduit of direct marketing, where you've got face-to-face interaction between the farmer and the purchaser, and in which you have a better accountability. What we've been trying to do is to calibrate the level of regulation based on that accountability and the proximity or the closeness between the producer and the purchaser. So that's basically what we're trying to do. I know we'll get 1990 signed into law, and that will complete our effort to essentially facilitate the approval of direct marketing, food produce, and sales. Next year, I think the big challenge is going to be looking at indirect sales, and without getting into the weeds too much, indirect sales are really those wholesale food production and food processing and food handling, and that is not only a difficult issue because it deals with scale, but it also transcends the traditional local state boundary, and state government is by and large responsible for most of the indirect sales or wholesale food safety requirements. So when we move from cottage food or we move from backyard production or community production, and we allow that food to be sold into the market stream that isn't direct, in other words, there's a third party or a fourth party involved, then it gets into much more difficult regulatory arena. But that's something that is probably the next step, where people are calling for allowances of indirect sales of this local small-scale community production.
Thank you so much for the update on that, Justin. And
sure.
I do want to mention that if you're interested in this topic and you want more detail on AB 1990, that Justin did a presentation for us back in March, and it's on our website, and we'll include the link in the email that we send out after this call. So at this point, I think we can open it to questions. And I know it was difficult for people to get through our muting, but just make sure to unmute on your phone and then dial *6. And you should be able to go ahead and ask questions. Hopefully. And I think I'll go ahead and start with one in case people are struggling to accomplish that. I guess the question that I had for Liz and Naomi was if there were many examples of schools that were successfully using the Culinary Garden Agreement to do farm to cafeteria efforts, and how it was working for them. And Liz and Naomi, you guys will probably need to unmute yourselves by dialing *6.
Hi, this is Stephanie Singleton from San Diego County. I work closely with Naomi on the project. And one of our largest school districts, which is our San Diego Unified School District, implemented culinary gardens at approximately about 9 of their schools so far, and they're doing really well. So they're utilizing the produce in the cafeteria on a small scale at this point, but they plan on expanding it as the program gets going.
Yeah, I think what's neat about even on a small scale is that the kids that are participating in the growing of the project, they're knowing that even their 12 bunch of radishes are ending up on that salad bar. Obviously, the school food services is supplementing quite a bit those radishes with other locally grown, actually, radishes. So it's almost like viral marketing. These kids are pulling the other their peers to the salad bar. So it's really actually, we're seeing an increase in the participation and consumption of these products on the salad bar because of this process. And actually, we're looking at Encinitas School District. They have started a full-fledged farm, right. And Department of Environmental Health and I are in close contact with that school district, and we're going to see, I think, actually a pretty good significant volume being produced by that school district.
We have approximately about 4 school districts that are interested in putting culinary gardens into play for the next school year, in addition to San Diego Unified.
That's great. Thanks, guys. An additional question that's come through our chat box comes from Kathy Ardiel, and her question is, what will be the role of the agricultural department in the small-scale garden production? And I think that may be a question for Liz and Naomi, but maybe also for Justin.
I can talk about it at the state level because it has been a little challenge for us in crafting statewide legislation, and I think the others can talk about the local level. In many cases, it might be a lot easier to secure this full collaboration between public health, environmental health, and ag commissioners than it is at the statewide level. But we did get involved for over a year-long working group under the auspices of the Secretary of Agriculture, working with ag commissioners and other interest groups about promoting direct marketing. And environmental health regulations at the time, this is 2.5 years ago, was seen as sort of an impediment, and that's what we've been trying to change. The challenge really has been that the food safety straddles the two agencies. It straddles CDPH, Department of Public Health, and CDFA. CDFA, as you know, has a considerable food safety regulations and requirements in place, and I've just referred to the egg producers. They have a whole egg production registration process through CDFA. It has also been, in some respects, easier to work with Department of Food and Ag because they have been willing and able to put best management practices up on their website rather than going through a very, very lengthy and very expensive formal rulemaking process to promulgate regulations. So we've been able to get these up. At this point, the ag commissioners, who are the local arm of CDFA for weights and measures and a lot of the ag registration and ag production processes, the ag commissioners don't have a direct role written into either 224 or 1990 as far as the approval of the source, but we will rely on those best management practices, deem them approved, and for both the CSAs and the urban gardens, environmental health has the explicit authority to step in and to charge a fee for any enforcement action that they need to take.
And how we've addressed it here in San Diego, this is Liz, is through the culinary garden agreement. That agreement includes best management practices from the agriculture department. They were at the table with us when we put this together, and the agreement also has a place on it where it indicates any sort of pesticides that they might use so that we can take a look at it and make sure that it's appropriate, and we check in with our ag partners to verify that. And ag would become more involved if they start claiming organic, but that's other than that, that's how we've addressed it here in San Diego.
Absolutely. We have been interfacing with our ag partners, and if we have any questions or concerns, they're willing to help us, but we are the lead agency that's handling these agreements. And we're able to do that because we're already at the retail food facility anyway, inspecting their kitchens or their commissaries. So since we're already on the site, we can help and educate them on how they can best implement their culinary garden.
I'm going to continue reading some of the questions that are coming through on the chat box because I think that's effective for some people. We just got a question that was related, which was, has there been any pushback at the state level for making these gardens an approved source?
No, we haven't gotten any pushback at all. It's been only encouragement and positive, feedback from anyone that has looked at our culinary agreement, culinary garden agreement.
Justin here again, just to add a dimension there. AB 1919 is intended to capture, at least have the sort of floor in terms of regulation for all of these. It's culinary gardens, victory gardens, community gardens, school gardens, all of those quote-unquote gardens or community food production, whether they're rural or urban. So that's the reason the author and others decided not to use the word urban production, because you could have these communities in non-urban areas. The defining factor here has been the land is not designated as ag land. That's the way we slice and dice that. But with respect to statewide involvement, other than the eggs, we've also had very good support from both CDFA and at least passive support, I would say, from CDPH.
That's great. Thank you. Another question that's come through is, does San Diego County Environmental Health Department allow retail markets, corner markets, to sell the community garden produce? And would that, I guess, be allowed under the approved source process that's been established?
Well, that's for San Diego to answer, but Justin, here again on the statewide level, I mentioned that is an area that we've struggled with a little bit. Current law and 1990 will allow the sale of this food that's produced in compliance with the best management practices in these community food production sites. The bill expressly allows the sale of that food to restaurants, which is strictly speaking an indirect sale or a wholesale sale, because the restaurateur, the person or the chef that buys the food, isn't the end user in the sense that there's someone that still consumes the food after that. So strictly speaking, it is an indirect sale, but we've had that provision sort of de facto for years, and that's been codified. But beyond that, we are struggling with how to allow, if to allow, and how to allow sale to these corner stores. And just like cottage food, the limit there was a monetary limit. We have limited the sale of indirect food, the indirect sale of food produced in a home to $35,000 to $50,000 a year, which is somewhat of an arbitrary figure, but it's one way of trying to keep the scale of the operation small.
Hi, sorry, it's Liz. We signed ourselves off accidentally trying to unmute the phone. But we have had actually a very large community garden in the City Heights area actually start selling produce from the actual community garden site, and we license them as a farmer's market.
Mm-hmm. Yes, we do.
And so the public or restaurateurs or others can go there. We really haven't had any requests made to us for sales, direct sales, or sales directly to a restaurant. But we do have some very large, a very large market store in Cardiff and some restaurants that have actually purchased land and have started their own sort of like mini farm that they're supplying the market and they're supplying the restaurant. So we're seeing this concept expand from just like the on-site culinary garden to markets or larger restaurants just purchasing land and creating their own mini farm to support their food establishment, which is really, really neat.
Which is neat for our staff. They're able to go out to the farm or the site because it's so close to the retail food facility and actually see the farm itself and see where the produce is being grown and how it's being grown, and verifying that there is good agricultural practices that are occurring at the site.
That's great. Thanks, guys. I think we have time for one last question. One that came through is, and I think this is specific to Marin County, but I think it's a good general question as well. If Marin County wanted to move forward with developing an approved source process, would you recommend waiting for AB 1990 to pass, or would you, in order to have sort of a statewide program in place, or would you advise an interested county like Marin to go ahead and move forward on their own in advance?
Well, from CCDH's perspective, the reason we sponsored the bill is to obviate the need for 62 local jurisdictions to establish their own programs, but at the same time we've provided and retained the local prerogative to be more stringent, to actually have a different program. So those that already have it could either adopt the best management practices and sort of modify their program, or they could stay with their existing program. Those that don't have a program, when 1990 is established, they could use that as a basis and they could augment if they need to. But that being said, we would hope that in addition to 1990, we don't have 62, modified programs, because it would defeat at least part of the object of the exercise. Great. Well, I think we've probably come to the end of our time, and I know that it was very difficult to ask questions, so my apologies to everyone. I have copied the questions that we've gotten in the chat box, and we will relay those and some answers perhaps from our presenters in our concluding email. That email will also include a link to an online application that you need to fill out if you wish to have CEU credits. That email will go out to everyone who is participating and has given us their email on the list today, as well as to our former list. And we'll also put the link up on our website, which is phasocal.org, if you wish to receive those credits for your attendance today. And I just want to thank again our wonderful presenters, Liz and Naomi. Thank you so much, and thank you for your wonderful work. And thank you, Justin, for really joining in at the last minute and making it possible for us to have this conversation about AB 1990. Sure. I want to remind you all that our next call is on September 16th from 2 to 3 p.m. The subject will be healthy mobile vending and how it can meet the aims both of economic development, environmental health, and chronic disease prevention. So we'll hope to talk with you then, and we will also be offering CEUs for that session. Thanks again, everyone, for attending today.
Bye-bye.